Welcome to Help! I Have Kids. I'm your host, Pam Marshall, a mom of 5 and a pediatric occupational therapist with over 35 years experience. This podcast is designed to equip you with practical tools, insights from experts, and real life stories. Because at the end of the day, you are the head of your child's care team. Each week, you'll hear from pediatric experts and fellow moms like you that will help build your confidence. They'll offer clarity and empower you to make informed decisions that work for your whole family. Today's episode, we have Dr. Luley with us. And what is a tongue tie? And does my baby have one? Hi, Dr. Luley. We're so glad you're here.
Hi, thanks for having me. It's so good to be here.
And tell us a little bit about yourself.
Yeah, so I practice here in a practice. It's called Pediatric Dentistry of Hamburg, but I've been there for 11 years as a pediatric dentist. We have a large practice that's in 3 different locations, and so yeah, definitely just, busy with pediatric dental world for the first half of my career, I'll say. And then I also I've been married for about 8 years, and we have a 6-year-old boy and a 4-year-old boy.
Oh, that's exciting. So you're
Yes.
a mom and a dentist, and how I'm guessing you got into infant tongue ties because of your journey. So tell us about that.
Yeah.
How did you get into?
Firsthand experience, I'll tell you. So I will say, early in my career, I did have a mom who brought her little boy to me because somebody had said that he had a tongue tie. And I was like, she said posterior tongue tie. And I was like, what?
What is that?
I was like, I'm unaware of that terminology. And I had just finished residency. And I think you have this idea of, you're like, I know everything and all the things. And I'm just like, it's going to be great. And then I was like, I don't know. And I just remember telling that mom, I was like, well, I don't really see anything. So, I do think that God works in mysterious ways because, our son Hunter was born. And, of course I wanted to nurse like most moms, you always hear, breastfed is, that's the goal.
Yes.
But actually really fed is best. So
that is the slogan we use. Fed is best.
So that's, but we had a lot of problems, nursing and, like bleeding nipples, blistering. I mean, he screamed in pain. He would be happy for like 10 minutes after he ate, and then he would cry again. And it was just this vicious cycle. And I remember, making an appointment at the hospital lactation office and trying to get lactation help. And I was told that, it's very normal for it to hurt this bad. You just need to get used to it. Here's a nipple shield. And I was in and out of pediatrician's office for like the first 3 months of his life because, I was like, something's not right. He just cries and it hurts and I don't know. And,
it's so traumatic when you're living those days.
It was
like
very
that.
traumatic. And I think it just like set up, we talk about, postpartum anxiety and depression, and all you want so much is to breastfeed your baby. And then you think that just you're doing something wrong. And so finally the pediatricians, they decided that he had a dairy intolerance. So, that was what was wrong with him. And then I needed to switch to formula. I did try to do dairy free for a little while, but it was a lot. So, we switched to bottles and he did better. And so I was like, he's actually happy. And I was like, okay, and then that's when I was really like, could try to pull back from everything and realize like, okay, he's happy. He's fed. Yeah. So it's okay. But it really wasn't until he was about almost 2 that I was having the same conversation with one of my friends who was not in the medical field. And she looked at me and she was just like, Amy, do you think Hunter had a lip and tongue tie? And I was just like, what? Like, I didn't even know.
Went off.
I was like, oh my gosh. Like, I'm a dentist and that's my territory. I'm supposed to know all the things about the mouse. And I didn't even look, and nobody even looked. So sure enough, I, looked under his tongue, and he was just so severely tied all the way to the tip. He could not move that thing at all. And I was just like, all the lights started, I was like, yes, okay.
And I bet that broke your heart. You were like, what?
Yes. And I, took a second to beat myself up, but then I was like, you know what? You don't know what you don't know.
That's
and
right.
All you can do is, now that you have that knowledge, just change the story from here on forward. And that's what I have to remind a lot of my moms of that in my office, because they look at me and they're like, why didn't I know? Why didn't they catch this?
Right.
And how did I not know I'm the mom? And I'm like, listen, I was there. I get it. But now you know, and now you can make, steps forward to fixing the situation and helping him now that you know. So after that time, I, vowed to make it my life's passion to get educated on the subject and be knowledgeable, because really, in reality, if I helped one mom, I thought just one mom not have the experience that I did, then, it would be worth it. So, and now, it is we are able to help lots of parents and babies, with what I do. So now I'm about 75%, in my tongue and lip tie center, and only 25% now in the pediatric dental world. But,
you have really become an expert on this tethered oral tissue.
Tethered oral tissues.
Yes.
Yeah. And I do love it. It's my passion, because once you really fully understand that, it takes a team. It's not just me as a dentist snipping something under the tongue. You can change anatomy, yes, but I could do that all day, every day, but we really have to change the function. And without that help and that big piece of the puzzle, you're never going to get anywhere. So I think a lot of my success comes from just, surrounding myself with great groups and great speech therapists and lactation consultants that can help these kiddos really be successful.
Well, I love that you talk about it being a team, because as a pediatric occupational therapist, one of my specialty areas was feeding, and especially feeding, infants that started out in the NICU and then post NICU, and as a mom breastfeeding five children, and knowing that breastfeeding's so hard. Yeah. So I'd love to hear, what do you want to say? I know there are moms listening. Some of them have breastfed maybe in the past and had great experiences, but maybe they have a second baby or a third baby, and that baby has a lot of problems.
Yes.
So, or they know someone who might have problems.
Right.
So what are some signs that helps a mom go, this might be tongue tie?
Yeah, sure. So, first and foremost, against the advice I was given, it should not hurt. You should not be bleeding and blistered. That is definitely one of the biggest signs that there is oral dysfunction present in your baby. So, first, number one there, but also, lots of gas and spillage out of the mouth. If you're having to, if he's soaking all of these burp cloths and when you're feeding, that's a really big issue. Clicking when feeding. Yeah, it's cute, but it shouldn't happen. You shouldn't hear them smack. Right. So those, I would say, just poor latch in general. A baby that, doesn't get a deep latch, they have a shallow latch, or they're popping on and off constantly. And maybe, or they're just eating all the time. So some moms will be like, oh, I didn't have any problems with breastfeeding, but I'm like, did you feed all the time? Were you were they eating all the time? And they were all night long.
Yeah.
And, they were able to stay at home. So that's what they just did. They just fed their baby all the time.
And they thought that was
thought it was okay. So, really those are the biggest things that would say, hey, if you're nursing, these are your issues. But also we have babies who refuse bottles, and they just take a long time to eat. If you're doing bottle feeding, you can never find the right bottle. There's lots of gas. The baby doesn't like this one, or you're stuck on a preemie-flow nipple and your baby's 3 months old.
And they can't advance.
Right.
And it's, it's a mom's instinct to feed her baby and to nurture her baby and make sure they're fed and make sure those diapers are filled both ways. And, that's our instinct as moms. And when we can't do that, it causes so much stress, so much internal stress, as you know, you've lived it.
Yes.
But I think for moms listening that either know someone or they're experiencing it right now, what would be the steps a mom should do if their baby or they know someone who's experienced what you just described? How do they get help? What are the steps?
Yeah. So we have to remember that not all speech therapists are trained, not all lactation consultants are trained, or pediatric dentists. Okay.
Right.
So, typically in your state, for example, we have a Kentucky tongue and lip tie support group on our Facebook page. So if you can just access those groups, those Facebook groups, you should have a preferred provider list. So, accessing those pages, but just being sure that the person that you're seeing is TOTS certified. So tethered oral tissues. So whether there's lots of different courses they can take, but what is their protocol? Do they see tongue and lip tie babies? So you just want to make sure that the person that you're seeing, does have that certification because it is a specialty certification. Like we talked about, like not all pediatric dental programs are going to teach that. Not all speech therapy programs are going to. So you really have to kind of take it. It has to be an area that you're really interested in for a person to get that feeding specialty. But and I have multiple parents who, I'm their third or fourth stop because they have reached out to a speech therapist or someone to ask about a tongue and lip tie. So if you have reached out and you still feel like that there are problems, go with your maternal instinct and keep reaching out until you really, really feel confident in the answers that you're getting. So definitely you want to just look for that certification. And I'm sure there's lots of them, but you want that for sure.
Yeah, that's good advice. And also I think you want providers who prioritize you, especially if you have a young baby who's really struggling to eat.
Yes.
I know in our practice, we prioritize making sure we can get those babies into the right provider and making sure that only providers that are trained well enough are able to help those little ones. And I think that's really important as well.
Yes, very important. If you're calling a provider and they're saying, well, we'll see you in, next month, or that's not okay. You have to, be able to meet that baby when they need you, and you can't push a newborn off for a couple weeks. So, and that's one thing I've tried to, make sure in our practice that, like, hey, when that baby is ready for a release, that's when they're coming. We're not making them wait. So with my second baby, of course, I did all the steps differently. So I had that prenatal lactation consultant. And the first thing, I did was check his ties when he was born, which he was tied. So, the steps looked a little bit differently in that situation, but I didn't even want to wait like 2 days to get out of the hospital to see my lactation consultant. But I'm like, okay, you gotta wait a couple days. So I definitely understand that.
And then did it go better?
Oh, it went so much better. Oh. Yes. He was released when he was like 10 days old. And so our lactation consultant that we had used and worked with, we did weighted feeds. So before the procedure, he was transferring maybe like an ounce. And right after the procedure, it was like 3.5. His tongue was moving. He was eating. So it is nice, to have both experiences, especially as a provider of tongue and lip ties. Like, I can be very honest with that mom whose child is 2 years old coming for the release about like, this is how it's gonna be. Versus, the newborn, the infant phase, so I've been through both of them, and I can relate to both sets of ways.
You've got lots of compassion for both experiences.
Yeah.
And it's really traumatic to go through what you went through, and to know, I think that's what we hope the message on this podcast can be. You don't have to go through that horrible traumatic time. You can get help.
Yes.
And, some of it is, moms typically talk to friends, or they talk to other moms,
Yeah.
Now, one thing that I caution moms is don't have other moms diagnose your baby.
Yeah.
Like, please see a professional. See a professional. Because I have seen that before too, where moms are trading pictures and go, oh, that's definitely a tongue tie, or that's definitely this.
We can't diagnose based off of pictures anyway.
Right.
So, and sometimes parents want that. They're like, well, what classification is it? How do you grade it? And I'm like, well, we grade based off of location of the tie, but really, how is the baby doing? Like,
what's the function? That's what I always say. What's the function?
What's the function? Because you can have something that looks awful. It could look terrible. You're like, how are you functioning like that? And baby's doing fine, or they're compensating well, or you can have something that doesn't look very bad and it's very hidden, those posterior tongue ties, but now they're calling them mid-body ties, which makes more sense to me.
Yes.
But, really being under the tongue that doesn't allow the tongue to elevate. So they look all different ways.
Yeah.
So it's hard to.
And that tongue has to get out. It has to elongate so long outside of the mouth around the nipple to effectively feed, which is shocking. I think a lot of moms don't realize that. And there isn't a lot of information about that, you know, and sometimes you wish you could see there was some sort of scanning video of your baby feeding and you could see it. Like, wouldn't that be cool if you could do that?
Yeah. But also on that, idea, another thing that a provider should be doing, if you take your baby to a provider to check for lip and tongue ties, they need to be in your baby's mouth.
Yes,
they've got to feel that suck. Like, how is the tongue functioning? Is it curling around the nipple or is it not?
They should have a glove on their hand and they should be all in their mouth.
Yes. And you should know, you can't just like peek in there. I mean, there's lots of, diagnostic tools that you can do from that. So, and that's sometimes lacking. I know that, parents have taken to a provider. They just like, did they even look under the tongue? And they're like, well, they can stick it out. So it's not fine. It's okay. Well, that's how we were trained 10 years ago. Does it go past the teeth? Okay. But really, you've got to make sure that tongue is moving like a wave. That middle of the tongue's got to touch the roof of the mouth, or you're not going to be able to nurse or feed or speak or,
Yeah. And the resting posture of the mouth, a lot of people don't realize that usually the tongue is up.
Yeah.
And it's something we don't think about, as we're talking, as we have a resting mouth posture for sure. So there's like a lot of things. Moms go to a pediatrician and they might hear, they'll grow out of it. What would you want to say to a pediatrician that says that? Like, if you could talk to a pediatrician who says, they'll grow out of it, and this mom is having a really difficult time nursing and asking questions, what would you want to say to a provider?
The best thing that I've heard in this situation is, if your shoes were tied together, could you ever walk normally? And you're never going to be able to walk properly until your shoelaces are untied. And so, that's kind of stuck with me because it's a very, very simple illustration that we can all understand. But so no, we don't grow out of it. Symptoms may start to be masked, and there's, Band-Aids on it because, baby learns to compensate, or you just move on, but it's not something that you can grow out of. It's either there, it's not there.
Well, one of the things I've really appreciated with your approach is, you talk my language when you say, we really want to know, can that baby learn to compensate, or are there things that can be done before a procedure, a more invasive procedure is done? So tell me your view of that, like explain that a little bit.
Yeah. I mean, it's so important to have that teammate aspect where you're working with that other person to do a functional assessment on the tongue. Because,
and when you say person, you're talking about like a feeding specialist, either a speech language pathologist or an occupational therapist, either or are trained.
Yes. Yeah. To be able to really look and see how is that tongue moving, what is happening, because I'm the surgeon. My specialty is releasing to cut, right? So that's the function of the tongue isn't my specialty. So just like if your surgeon feels like your gallbladder needs to be removed, you do a CT scan and you get that diagnostic criteria that yes, this is a problem. So, my hope is that but really your feeding difficulties, there could be a lot of things. It might not be a tie.
Right.
It could be the way you're latching or positioning or tension in the body or just weak musculature. So we need
to also be the shape of a nipple.
Right.
That there are some nipples that are really hard for a baby that has a really small mouth or a high narrow arch or something.
So we just really want to navigate that world, because the worst thing to do is to perform a surgery on a baby that's not necessary. So, as these providers, these speech therapists, occupational therapists are doing their functional assessment, they're weeding all of those things out, making sure, yes, their body feels great. There's no tension. We're feeding properly. So yes, the last resort is the surgical procedure, because it's a win in my book if I send a baby out for therapy and then they don't come back for surgery, because that means they have done their non-surgical therapy has helped whatever the problem was. And that's great.
And so do you recommend, like if a mom listening right now says, oh, I need to get help, do you recommend they seek out a therapist first, or do they have an initial visit with you and then you send them where they need to go, or what does that look like?
Yeah, we can do either way. So we do have some moms, that would just really love to come in for a consult with me.
Yeah.
And that's great. And I truly welcome that. And I will talk with that mom through the journey, but I'm never going to do the procedure that day. So, my coordinator is amazing. She spends the majority of her day on the phone talking to all the moms and explaining how the procedure goes. So, if we can refer out first, we always do, based on, child's location, insurance provider. What do they need? Do they need a speech therapist, or do they need an occupational therapist? Like, which route are we going to go? So it just saves the parents a trip. And it saves time too.
Right.
If they're not waiting a week or a couple of days to see me.
Get it done quickly.
Get it done quicker by removing that initial consult out of the equation.
And insurance can be a barrier too, because, some families are more limited in their resources, and my goodness, they just had a baby. That's a huge expense.
Yeah, exactly.
A lot of time for all of us. It's a big expense. So wanting your insurance to cover is a big one.
Yeah.
Being able to have coverage.
Yeah. And in our office, we do take all forms of insurance. It's not something that I ever will go away from, just because I feel that all babies need to eat. It's not about the money that I'm charging but I want to help them if we can. It shouldn't be about cost. So,
I think we have the same heart.
Yes.
In that I just absolutely cannot stand when children can't get what they need. Yeah. And so you want to help them regardless of.
No, regardless. I know people tell me all the time, they're like, you should really raise your fees. And I'm like, no, it's not. It's not really about that, because, we want, care for all kids.
That's
all
right.
Kids, all babies. I want all the babies to be able to eat.
Yep.
And
all
speak
babies.
And feed, all the things.
That is good. And what is the difference? We talked a little bit about making sure, the evaluation is done properly from a therapist, that they're actually in their mouth. But what about other providers, like moms here? Oh, I need to go to a chiropractor. I need, to make sure I have maybe craniosacral, or I need to have body work done. Or do you feel like going to the therapist is a good start, because then they can help guide some of those other things? Or what is your approach when it comes to some of the other?
Yeah, I definitely, that's definitely my starting place. But we do have parents who start in the chiropractor, and the chiropractor or the, craniosacral massage therapist will say, hey, I think you've got some ties going on. But, in our office, we always require the therapy component to be the major key player. And I think some groups can handle all of it in-house, like all of the body work, because some OTs do a lot of body work with themselves. So, a baby that's really, really tense, if a speech therapist doesn't have the body work knowledge or not an OT to help, then I think that, maybe that's a great place or a start that they should do body work outside. But it definitely makes the procedure more successful to have all components covered.
Tell us a little bit about, I know a lot of moms might be wondering, what does the actual laser procedure look like? Like when you go to do a frenectomy, you have a specific LightScalpel laser. Can you tell us about that and walk us through that?
So, the LightScalpel is a carbon dioxide based laser. So it is actually a laser beam that vaporizes tissue. So it's great. It is, the most high quality on the market at this point. So it doesn't burn the tissue. We can do anesthesia free releases, which are so nice with these little babies. You don't have to be put to sleep. And now older kids, yes, maybe, but not newborns. We do anesthesia free releases on them. So, we swaddle the babies up and, it's a quick 2-second procedure and they're back with their mom in like less than 2 minutes.
And how soon after can they nurse?
And they nurse immediately.
That's so happy.
It's so great. The parents are like, oh my gosh, it's so quick. Like I had one family that was like, I waited at a stoplight longer than it took me to do the release. And I was like, it's so fast. But they go back to mom and they can nurse right after. And it's great. And for a lot of those moms, it's just a relief because it does, it feels better already. They are just like, oh my gosh, it feels so much better and it doesn't hurt. And they're, not clicking or look how much they're not spilling from their mouth. So it's really great to see that happen. And some of it isn't immediate. Like I always have to, remind some parents, like this is a marathon, not a sprint. So you gotta, work on that function and it'll come. But, it's really great to see that.
Yeah. 'Cause you hear those stories, or I have moms coming in saying, well, I didn't know I was supposed to do anything after. Like I had this procedure done and we didn't have any help after. We just went home and, And so talk to me about that a little bit. Like, how do you educate your parents on the after?
So, super important to have that wound care afterwards. I always explain it to the parents. Well, if you are going to do a knee replacement, you have to do physical therapy on your knee to be able to walk successful. So that's what the aftercare is going to be for after the procedure. But, we are doing exercises in the mouth wound care every 3 to 4 hours. And that's honestly the most important part of the whole procedure is to make sure that you're really doing your wound care because it will reattach. I mean, your tongue is in the floor of the mouth. And if you're not teaching it where it needs to heal, it's all going to grow back together. So it's super
moms need a little toughening up because we moms cry inside to make our baby cry.
We don't
like it. We don't like it. So you really have to go in this going, I'm going to be a superhero mom and I'm going to push through the pain that I'm feeling having to do this.
And I always remind them, I'm like, listen, you're not doing this to them. You're doing it for them.
Yes.
So, and the procedure, I actually used the laser on my lip. I didn't really have a lip top. I was like, I want to see how this feels. Cause the older kids will tell me it feels just like a little canker sore or a pizza burn. If they've never had a canker sore, burn their lip on hot chocolate. Sometimes I'll hear that and it really does. I mean, that's exactly what it feels like. I didn't pay attention to it most of the time. And so I really, walk hand in hand with that family and say okay, they're mostly angry because you're putting your hands in their mouth. They don't like it. And it does, a little uncomfortable for the 5 seconds you're doing the release, the stretches, but they recover so nicely. And they're just, after you stop, you're like, oh, okay. So, it is important that they realize that they'll cry for the first few days, but it's mostly just because they're like, get out of my mouth. What are you doing?
Yeah, that's very true. That the recovery, kids are resilient.
Yes,
and babies are so resilient.
Yes.
And again, it's harder on
It is harder on the parents, but that's
moms.
also like the most, we work with our providers, like you guys, to ensure the timing of release is important as well for the family that's going to go through that. So pre-procedure care, you're making sure, just like you wouldn't just go run a marathon. You've got to stretch and strengthen those muscles so that you can be successful for your procedure. And that's why it's so important to visit with your speech therapist, your occupational therapist before the procedure, just to ensure that baby is truly ready, that family is ready, that they're prepped, that they know what's going to come. Because a really good therapy group is walking that family through that hand in hand.
Yes.
Like they're giving them, brochures and handouts, like what's it going to look like? And this is how you do your stretches. And they've been doing stretches in baby's mouth. So baby is comfortable with the procedure. So, that is just one of the really good reasons that we require pre-procedure therapy.
Yes. So going to therapy first helps. It helps you get ready, moms, for the procedure. And it also helps the baby get ready. They're used to hands and mouth stretches. You set the routine before you actually have the procedure.
Yes.
So that's really good advice for people who are listening and thinking, oh, this may be what the journey we need to go down.
Yes. And I can't stress enough that, we can change anatomy all day long, every day as pediatric dentists or, whoever is doing the release, but we cannot change function.
That's right.
And your function will not change until you have a provider that's helping you change the baby's function.
Coming alongside of you.
Yes.
And
walking with you through that journey. So, I would just feel like if nothing comes away from this, from our podcast today, just, if you meet with a provider that offers to snip or clip your child that same day, that is a red flag. Do not do the procedure because you are likely just creating more stress for yourself in the long run. It's not gonna be your magical answer that you're hoping, because it's just the baby's not ready and they haven't been worked with and they don't even know what to do with the tongue once it can move.
The outcome will not be the result.
Great.
Yeah,
it
will not be the result you want.
No.
Right. So to wrap this up, if moms are listening and they're thinking their baby might have a tongue tie, they can reach out directly to your office. Your office can guide them on, because you all have recommended providers. They could also join that Facebook group, the tongue tie provider Facebook group, and get a list of preferred providers there, as well as they can talk to their pediatrician if they haven't, but there are some that will be open to it and some that will not. So just being prepared there.
Sure. Yep.
And then your office will help guide them through.
We would love to. Yeah. So my tongue and lip tie center is part of Pediatric Dentistry of Hamburg. And we have our coordinator. I'll give a shout out to Laura, because she keeps it running. She keeps me going where I need to be. And she just, she pours her heart and soul into her job, even so much that she is just taking classes right now to learn more about, being a lactation consultant. And she's just like, I just want to help these moms. So she'll spend as long as you want on the phone. Like, she will walk you through your options. But you would just call our office number and the number for the tongue and lip tie center. And so she could get you help, and then she would get that appointment scheduled with me if you want to do a consult, or she will get you referred to a provider group, and then that therapy group contacts the parent. So
that's
it's super
great.
Easy. You don't have to do anything.
I know our therapists really enjoy working with you. Yeah. We have therapists who specialize in TOTS.
Yes,
and they enjoy
great.
The partnership with you for sure. And we'll have those details below the podcast. But to wrap this up, I want to ask you a question that everyone that comes on the podcast I ask, and that's, what's the best piece of advice or encouragement that you received as a mom?
Yeah. And being a mom is hard. Being a parent is hard.
It really is.
You're faced with decisions every single day, like, what do I do with this situation or that situation? And the best thing the advice that I've ever been given is, you are that child's mom for a reason.
That's
and nobody is more perfect than you are. And you will make the best decision. Take all of your knowledge that you have at that time in your life for that moment and make the decision. And it will be the right decision.
Yeah.
You can't beat yourself. You can't question it constantly.
Right.
But in your instinct, like what's the best for your child, and use the knowledge you have to make the decision. And it's always going to be the best one.
That's so good. Yeah. We can just empower these moms. They can do it. They can.
Yes,
you all can make decisions. I know we can too as moms.
So hard.
Just make those next right decision.
Yeah. Just always in the moment. Yeah. Like, for today, this is what it's going to be. Yeah. And,
Well, I appreciate you taking time to come on today and to talk to us about your expert area of tethered oral tissues.
I'm happy to. I love it. I would love to help anybody that needs it. Thank you so much.
Thank you, Dr. Luley.
We love working with you too. You guys are great. You guys are awesome.
Thank you. Thanks so much for listening to Help, I Have Kids. If you're tuning into this podcast, that means you're a mom who's curious, committed, and ready to learn. And we see you. We'd love for you to join our Help, I Have Kids Facebook community, where moms just like you are connecting, asking questions, and encouraging each other every day. It's a space for real conversations, expert insight, and support from moms who get it, because we're all in this together. And if you know a mom who's feeling unsure or maybe overwhelmed, or just needs to be reminded that she can do it, she can advocate for her child with confidence, share this episode with her. We're building a village here, and we're glad you're a part of it.